So I want to start by saying thank you to the organisers for this opportunity to talk. I think what I'm going to say today really does complement what Kerry has already talked about by taking a bit of a deeper dive into mental health and alcohol use in adolescents, changing trends over time. I am going to start my talk by talking about what we already know and then talk about some of the data that we've been collecting over the last 15 years or so from adolescents across Australia that might challenge some of what we already know, and also then talk about some opportunities. So we know that anxiety, depression and substance use disorders are a significant health challenge with a typical age of onset in early adolescence or early adulthood. These disorders have been described as chronic diseases of the young. We've recognised for a while now that treatment is not enough and that we need to look for new ways of averting burden. And so that's why, as we all know, while we're all here, prevention is crucial. Anxiety, depression and substance use disorders typically co-occur and interact. We also know that pre-existing mental disorders increase the risk for subsequent mental disorders, regardless of the type of disorder. So understanding the relationship between these things is crucial, and understanding how those relationships might have changed over time is also vital to improve our prevention efforts. And as we've already seen from Kerry's wonderful presentation, there is evidence that adolescent experience of these things is changing over time, really signalling a need to shift our thinking. Here are results from two nationally representative surveys of child and adolescent mental health in Australia conducted in 1998 and 2014, and they show an increase in the prevalence of depression, almost a doubling over time amongst 12 to 17-year-olds. Data from the Australian Bureau of Statistics demonstrate that rates of suicide amongst adolescents are at their highest in the past decade, and suicide remains the leading cause of death among young Australians. In contrast to this, the prevalence of alcohol and illicit drug use is plateauing, and in some age groups, particularly young people, declining over time. Here are data just released this year from the most recent Australian National Drug Strategy Household Survey, a survey that's conducted here in Australia among a representative sample of the population every 3 years. What we can see is that amongst 14 to 17-year-olds in Australia, in 2019, 2/3 report that they've never tried alcohol. And this is a dramatic increase from 28% back in 2001. While there's still a sizable minority of adolescents who are drinking at risky levels, this survey also shows that there's been a decline in the proportion of people exceeding the lifetime risk guidelines, and that this decline is driven by our young Australians and not found in the older Australians. So with these data as a backdrop, I want to present some new information and some new data on changes over time, not only in the prevalence of mental health problems and alcohol use, but also in the relationship between these constructs. We're actually motivated to do this by some of Kerry's work that she's done in monitoring the future. And we wanted to do this in younger adolescents to see whether the relationship between mental health and alcohol use has changed in young adolescents when these things are beginning to emerge. So we use data that we've collected as part of baseline measurements of a number of large-scale substance use and mental health prevention programs, and that we've been collecting over the past 10 to 15 years. Our total sample size includes roughly 14,000 adolescents who were in these graphs 13 in 2007, 2012, 2014 and 2019, thus spanning 13 years of historical time. I think the consistency and measurement of mental health and substance use and attitudes and behaviours really makes this a particularly unique data set. So replicating the broader trends that we see in national data, You can see here that the prevalence of alcohol use, defined as at least one standard drink in the past 6 months, in the 6 months prior to survey, has decreased amongst 13-year-olds over time. And coinciding with this shift, we have seen increases in the prevalence of high psychological distress using the K6 as a measure, which I'm sure many of you are aware of, over this same historical time period. We also found that that the association between high psychological distress and alcohol use seems to be getting weaker over time. So these are odds ratios that talk about the odds of having high psychological distress if you have high alcohol use. And we can see that back in 2007, the association between these constructs was high. But we seem to be seeing over time almost a decoupling of these constructs, or the relationship between these. Just touching on some of the sex differences here, when we split these data by males and females, there's some evidence that these trends differ. Reductions in the prevalence of alcohol use over time seem to be more pronounced in males, while increases in the prevalence of high psychological distress seem to be more pronounced in females. And so one thing that struck us was that whether these shifts in drinking behaviours are actually mirrored by shifts in perceptions about drinking. So in this data, we have unique information about adolescents' perceptions of how many of their peers are drinking at all and how many of their peers are drinking to get drunk. We know that adolescents overestimate typically how many of their peers are drinking, and actually renormalising these estimations is one of the strong tenets behind a social influence approach to drug and alcohol prevention. But we were particularly interested in whether these perceptions have changed over time. And here we can see that there's a clear shift in the perception of peer drinking. Back in 2007, only 25% of adolescents believed that none of their friends were drinking, while in 2019, this figure has jumped to 69%. And a similar pattern of results is found when we look at perceptions around peer drunkenness. How many of your friends drink alcohol to get drunk? And while I won't show you the data here, we've got similar data in terms of intentions to use alcohol. We see changes over time amongst early adolescents in their intentions to use alcohol in the future, which we know are predictive of actual alcohol use. And we also have seen an increase in knowledge about the harms. One of the things we ask about in all of our studies is a range of questions about harms associated with alcohol use and knowledge around guidelines, Australian guidelines. And we see actually that, adolescents' knowledge about the harms of alcohol use have increased over time as well. So with that in mind, I guess one of the opportunities that these findings give us, and both these findings and what Kerry has shown, is to ask us why. Why are we seeing these trends, and why are they seem to be going in different directions? So it would indeed be a magic bullet if we could identify some factors that explain both the decline in alcohol use and the increase in mental health. And as Kerry has suggested, screen time has been proposed as one of those magic bullet factors, but the jury is definitely still out. I think the notion of rapid changes in contemporary social and leisure contexts that adolescents find themselves in, maybe a shift away from face-to-face interaction and more towards online social contact, as at least part of the explanation, really does require more and better research. And I'm really excited to see the work that Kerry presented here today in that area. Kerry also touched on this, but the parents of today's adolescents are no doubt parenting in different ways to parents of the past, and we've seen a greater engagement of modern parents in the parenting process, greater monitoring, rule setting, communication, which can, no doubt have positive and negative effects. So in conclusion, I want to make a few points that we can discuss over a virtual cup of coffee. I want to say that this is by no means the end of the story. In some ways, we're at the beginning of a trend that will require further investigation as our adolescents of today age into their 20s, 30s and beyond. In my opinion, it's crucial that we keep measuring. These constructs. We measure them in the same adolescents over time and with consistent measurement. We don't have, wonderful data sources like Monitoring the Future here in Australia, but, I think we can make use of existing data, harmonising across a range of different data sources. I haven't talked today about how mental health and substance use and their risk and protective factors play out longitudinally across the adolescent years. This is a whole separate body of work that also provides important information about etiology and prevention. And I think probably to get a true picture, we need to combine that cross-cohort data and research that, both Kerry and I have shown today within cohort changes over time. We have some wonderful long-term longitudinal cohorts that are just such important information. And I think we just need to, continue to reconceptualise our search for risk factors with a potential decoupling of mental health and alcohol use relationship over time. We need to think about new risk and protective factors that explain these diverging trends. So I'm slightly over time. I will end there and thank my collaborators and funding sources. Thank you very much.
Thank you very much. Thank you, Tim. And I can hear the thunderous applause happening in lounge rooms around the country. Tim, I'm going to just ask you one question. It is absolutely shocking to see the similarities between the figures that you presented and the figures that Kerry presented from on the other side of the world. Could you just tell us a little bit maybe about that moment when you both shared the data with each other and what that means?
Yeah, I mean, it's also interesting that these are just not trends we see in Australia and the US. These are trends that we see in many, particularly Western countries around the world. There's some fantastic research coming out of Europe with their long-term surveys as well, showing similar declines in alcohol use and similar increases in mental health problems in adolescents. So this is not a one-country thing. This is a global experience, and it's something that we really need to address moving forward.
So, Tim, there are lots of questions coming through. In the interest of time, I'm going to have to move on to our next awesome session and next Ignite talk, but keep the questions coming, people, because we will answer them through the course of the forum. Thank you again, Tim.
Thanks, Marie.
And without further ado, I now have the great pleasure of introducing our next presenters. And we may actually have a little bit of time for questions, Tim. I've been allocated a few minutes for questions here, so I am going to throw you another question. So
Sure.
The decoupling of the relationship between alcohol use and mental health. People just wanted to understand that a little bit more. What do you mean by that?
So what I mean by that, and what we looked at was how many more times likely are you to have high psychological distress if you also use alcohol. And
right.
Amongst the 13-year-olds that we surveyed back in 2007, the odds of high psychological distress amongst those who use alcohol is 4 times the odds of high psychological distress amongst those who don't use alcohol. And so what we see, though, is that relationship between alcohol use and psychological distress is weakening over time. It's still there. It's still significant. Those who have high psychological distress also, at the same time, are more likely to use alcohol. But the relationship is weakening. And that kind of signals, well, one of the implications of that is that perhaps there are different risks driving those two experiences. And so I guess that's something that we want to unpack in these data. we typically have said that the risk factors for anxiety and depression can overlap with the risk factors for substance use and substance use disorders. But maybe that's not the case these days. Maybe there are different risk factors that are driving those two constructs and also driving them in different directions over time.